Hello, I am Dr. Sandeep, a Director for Radiology and Imaging Sciences in Tenet Diagnostics. Tenet Diagnostics is present in the states of Andhra Pradesh, Telangana and Karnataka. We have more than 8 centers catering to a wide variety of investigations, including imaging and pathology. What I'm going to be talking to you right now is an entity which has a lot of effect on the elderly population, especially in terms of most of these elderly population suffering from joint pains. Now, all of us know about an entity called osteoarthritis. It is very common, especially in the elderly, people who are above 60. But what most of us do not know yet is that even the younger generation, or even the younger people as young as 30 years and above, are also suffering from what is called as a depletion of the cartilage. Now, the cartilage is a soft layer between the two bones, and it is a sponge which effectively cushions the movement of the two bones in the joint. What happens when this cartilage gets damaged or eroded is that the thickness of this cartilage keeps coming down subsequently, and these bones get approximated with each other, and that causes a lot of friction and that causes a lot of pain. So what we need to understand is, for those of us who are very active, especially those of us who are into active sports such as running, jogging, we do not know to the extent of damage on what has been taking place in our joints. So an excellent tool to assess what is the status of our joints is a technique called MR, which is very useful in estimating the damage or health of the cartilage. Now, most of the cartilage, the healthy cartilage, is filled with a lot of fluid or the water. Now, there is a technique called cartogram which can help us estimate the health of the cartilage, whether there is optimal water content in the cartilage, which means it's healthy, or whether there is a depletion of the water content, which means it is diseased, and to what extent is the cartilage diseased, whether there is any ulceration, whether there is any fissuring, or whether there is any thinning of the articular cartilage. If there is thinning and we can find it out at an early stage, your doctor has a chance to institute prompt therapy. It may be in the form of a few injections into your joint, or perhaps instilling a cartilage or a chondrocyte implant, which can actually help us repair the cartilage by itself and help the cartilage heal itself. Why is this important? Because at a young age, let us say when you are 30 or 35, if you can detect cartilage damage and you can correct it promptly, what happens later on when you are crossing 45 or 50 years is that your cartilage remains healthy, and you can avoid getting into a stage where most of the elderly suffer, that is osteoarthritis, which is a complete depletion of the articular cartilage and loss of volume of the cartilage, as well as approximation of the bones together, causing a lot of damage to the bones also. Now, what happens if there is an extensive damage to the bones? The only other way you can treat this, apart from giving steroid injections, is to undergo a replacement. Replacements are expensive, replacements are worrying, and replacements also mean that you need to undergo a lot of physiotherapy and a lot of damage control, which is totally avoidable. So this is a technique where all of us, or most of us who have any kind of a active lifestyle, or people who have obesity, or people who generally have pains and aches which are not much but still continue in their routine work without actually looking into what could possibly be wrong. Now, these are the segment of population that I would urge to make use of these techniques called MR cartograms and try and realize what is the cartilage health, and see if they can look at their cartilage in depth and try and give ample time and facility for the orthopedic surgeon or any of their physicians to understand what is happening to the cartilage and decide whether you need any kind of a prompt treatment right now or whether it can wait. For the elderly, we also have this technique which is very useful in terms of documenting the cartilage health and documenting to what extent the cartilage is damaged, so that the physician or the surgeon can take a call on deciding to go for either a replacement of the cartilage, or for stem cell therapy or steroid injection, or in the worst case scenario whether one needs to undergo replacement. It can be either in the hip joints or it can be in the knee joints. Of late, there are a lot of recent advances which are giving us a lot of insight into ligaments and cartilage as well as the bone, especially in people who are active in sports and people who need to be active in sports in terms of documenting their shoulder and elbow injuries, especially in overhead sports. Lot of times we have heard of people suffering from ligament injuries, especially rotator cuff injuries in sports like badminton and cricket. Now, these are techniques which can give us very good insight onto what is happening to their ligaments, whether it needs a repair or whether it needs a lot of healing in terms of giving it a bit of rest, and then the healing takes place automatically. So MR can be very useful in sports injuries and sports medicine.